Androgen suppression is an important part and the backbone of treating patients with prostate cancer. We know that prostate cancer cells are driven by testosterone, and reducing this, androgen suppression, is an important backbone to the patient's treatment. At the moment, this is done with LHRH analogues that suppress the patient's testosterone. But in doing this, as a side effect, they also reduce the patient's estrogen, because in men, estrogen is produced from testosterone. But you don't need to drop the estrogen to treat the prostate cancer. The point about that is that additional drop of estrogen contributes side effects, and lots of the side effects that we associate with androgen suppression in men, so in particular hot flushes, which keeps them awake at night, and deteriorating bone health and fatigue. Now, an alternative mechanism of producing androgen suppression is to give men estrogen. And that estrogen, through a negative feedback effect, suppresses the testosterone. So you get the anti-cancer effect, but you mitigate the side effects caused by the loss of estrogen. Estrogen has previously been used as a method of androgen suppression in men, but oral estrogen, so stilbestrol, given as tablets, has a higher rate of causing cardiovascular side effects, so particularly deep vein thrombosis, pulmonary emboli, increased risk of cardiovascular disease. Really importantly, estrogen, when given as patches, avoids the first pass hepatic metabolism and avoids those side effects. And in fact, within the early stages of patch, we had a cardiovascular cohort, and we've shown that there's no increased risk of cardiovascular disease in men with prostate cancer treated with estrogen patches. So that was a really important step along the way of the TE2 development program.